Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm doing well, Jared. How are you?
Great. I'm a little tired, but not too shabby. Feeling pretty good.
It's
Um,
always good.
Still getting used to. I recently moved to Florida, and it's like I want to say in the mid 80s today, and I'm wearing like a long sleeve sweatshirt outside. So I'm quickly getting acclimated to the climate down here.
Yeah, I'd have to say I think it's probably a good indication because I think you're from New England area originally.
hmm I just moved here from Boston a couple months ago, and yeah, I think it was good that I moved here a couple months and I got to ease into it, right? I started out in their winter into their spring, and now we're quickly heading into the summer. Because I'll tell you right now, if I was coming from New England here today, I would think it's miserable outside. And now I'm like, oh, this is kind of nice. So
You wouldn't be wearing a long sleeve, that's for sure.
absolutely. Yeah. Well, I'm really excited for us to chat. I think we should dive right into it. I'd love if you could tell the audience a little bit about you and your background, and then we'll go into your role at SonderMind and our topic of the day.
Sure. Yeah, I mean, maybe I can start off a little bit kind of like the journey that got me here, if that would be helpful. So, so to start with, I'm a child, adolescent, and adult psychiatrist by training. I also have a master's in health. A lot of what I do with that is looking both at the individual, but also, frankly, as a population, right? And looking at quality and engagement and access. And it's always been sort of part of my career. But before I became a psychiatrist, I actually originally started off, so that's why it's just sort of interesting, slightly ironic what's going on right now is I started off as a microbiologist in undergrad and went to medical school thinking I was going to do infectious disease and actually did my master's thesis in something had to do with tuberculosis and so forth over in Russia. And so, you know, it's always been sort of this confluence for me. And then I finally got into medical school and really saw what the impact is needed and can have within the mental health space. And so shifted when I was in med school and then did my residency at, started at Wisconsin and then did my residency at Dartmouth and did a master's at Yale. And so I know New England well, and then came out to Colorado and was after doing my residency and fellowship and did a number of roles with Kaiser Permanente for about 10 years and was really excited. It was a great time, had met some great people and had a lot of great experiences to really build on the quality and engagement components for mental health care. And so from there, I went Optum Behavioral Health and was a senior national senior medical director for a couple of years. And again, continued to have a great journey to look at factors that go into and determinants for mental health and being able to implement different operational supports for that. And then finally, and last but certainly not least, is this terrific opportunity of being the chief medical officer for SonderMind. And in fact, I just passed my 1-year mark with SonderMind, and it's been an exciting, really great journey with amazing people, starting with, and I know you had a conversation with Mark Frank, co-founder and CEO, and really the mission-driven company that we are. It's just been such a terrific experience to come along for the ride and help build out clinical quality as well as other innovation and integration efforts that we're doing as well. So have a small team that works very multidisciplinarily across a number of business lines within SonderMind. So that's where we're at.
Yeah, thank you for that intro. I'd love to shift focus if we can to what your role looks like at SonderMind, because I hear chief medical officer, and every chief medical officer, while there are some similarities in the role across different companies and organization types, it seems like there's some different parts to it at each company. So I'd love to hear at SonderMind what your role as chief medical officer looks like.
Yeah, so it's a great question because you hit the nail on the head. I think it's a little bit different at every company, right? And frankly, it's a little bit different at every company at every stage of that company, right? So it actually morphs over time. Where we are and where we really pride ourselves and want to support our mission to have more accessible, utilized, quality behavioral health care to millions of people is we are looking at kind of three main areas. One is the quality piece. And quality comes out of different metrics that we can look at. And that's actually part of our tech-enabled talk therapy component, where we can engage the client and the provider to actually have the clients give feedback about how they're doing with regards to depression or anxiety, or how is the therapeutic alliance going, or how are they doing functionally. So we're able to start, we're collecting those data, and we actually can show some really interesting outcomes, which I'm happy to talk about as well. What's also really important in all this is the data for data's sake, and this is the other kind of key factor besides quality, isn't anything unless you're able to do it in a way that actually is meaningful, understandable, and timely for our providers and our clients. And so that gets to another key area is around engagement. So we believe very strongly about engaging not only with our clients, but with our providers, and making sure that they can be successful, not only on their private practices, that we again support through technology and other factors, but also their professional development. And so how do we also give them value and support them in their professional lives as well? And then last but not least, another key area is this piece of integration, an ecosystem, and really making sure that behavioral health is not as siloed as it traditionally has been. And so being able to cross those barriers and get into those medical practices, et cetera, and really decrease stigma, create kind of that what's called the medical home, where we're a part of that treatment team, and we can make sure that we have that engagement going forward. So those are some of the key areas, and of course we can kind of click down into individual areas, but I would say that I lead that team and I lead those efforts, again, very cross-functionally, but really kind of keeping that true north and that compass towards that quality and that engagement piece for our clients and our providers.
Yeah, thank you for that. It's always really interesting for me to hear how these chief medical officer roles look at each of the different like health tech companies, digital health companies. And I was going through our list of past guests in the past, and I was even surprised at how many chief medical officers we've had on the pod. And we've had different ones, right? I think a chief medical officer at a health system is much different than a digital health or health tech company, right? The roles are very, very different, and depending on the type of digital health company, health tech company, the role is also different. So there is no one size fits all for a chief medical officer, and that's why I always love asking that. I'd like to, before we kind of wrap up, this is a quick podcast, and hopefully we can have you on again and other members of the SonderMind team as well. I'd love to quickly touch base, and I know you brought this up a little bit in your when you were talking about your role, but quality management and mental health. I know that was a key topic we wanted to quickly go through today, and then maybe at some point elaborate on it more.
Yeah, I think what's interesting, so what many people don't necessarily understand is at times it's actually quite hard to measure quality, right? We don't have necessarily that blood pressure, we don't have that heart rate, we don't have the blood sugar, for instance, right? And we don't have an image that we can go to understand, gosh, this person is getting better because that bone is healing, right? And we can see this. What we do have, though, and as I was alluding to, is we have these outcomes measures that we can ask clients about, and they're highly, they're standardized, right? So they're evidence-based. And it seems simple enough to be able to have a client and a provider to get those data and use it, but it's actually quite difficult. Though it's been sort of standard of care for some time, it's hard to implement, right? And there's a number of barriers that, again, we don't have to get into every single one of those, but suffice to say, it's a bit of a challenge to sometimes get those data. So to get that patient-reported outcome data, we can do that, and through technology, you can do that. And we can make it easy. One of the mantras that we have is make it easy to do the right thing. And one of the ways that we can do that is to actually push it out automatically, these questionnaires, and get those through the client so that the provider doesn't have to feel like they have to fumble through. And, in the old days of sending it out, not electronically, but on paper, we can do all this electronically. We can get those data in. We can display that data to that provider at the time of the appointment with that client, which is so critical. So it really becomes almost like a vital sign, shall we say, right, of blood pressure or heart rate or blood sugar, of that person coming in that door to understand, gosh, they're not doing as well this week with their depression, right? Or they're not doing as well with their anxiety, or not functioning as well socially or in their job. So maybe it's something I should discuss with them. So it's, again, it gets back to quality and quality management. It's managing the data. It's getting the data to the right people at the right time. And it's also allowing us to then be able to track those data to see how folks are doing. And so what's really great, and this is stuff that's going to be coming out very soon, is that we at SonderMind can actually start showing really some of the efficacy data, not only about access and providing excellent access, but also, again, getting people better faster with depression and anxiety specifically. And so, again, that is that feedback loop. We want to get that out there, globally and to others, right? We want to be able to show that SonderMind is having benefit to people, but also, again, to those individuals, right? To those individual clients and providers in those sessions. And that's really important to us.
That makes a lot of sense. Yeah, and thank you again for sharing. Well, I want to quickly wrap up and again say thank you so much for joining me on the podcast. I really appreciate learning more about your journey into the Chief Medical Officer role at SonderMind, what that role looks like, and then your thoughts on quality management within mental health. So thank you again so much, and hopefully we have you on again soon.
Thank you, Jared. Appreciate it.